This is a review of SnoreMedic for SnoringMouthpieceReview.com. The review will show you what comes in the box, how to fit the mouthpiece, results from a patient after wearing the mouthpiece and cleaning tips. When it arrives, SnoreMedic comes in this box. Inside the box you'll find instructions for fitting the mouthpiece along with the mouthpiece and its case. Here you can see the instruction booklet which comes with SnoreMedic. One side of the booklet shows you how to fit the mouthpiece while the other side gives warning for people who should not wear the mouthpiece. Here you can see the mouthpiece case. Inside of it is SnoreMedic, wrapped in a plastic bag. The mouthpiece comes with a fitting plug which is used to help keep the front airway open during the fitting process. Here you can see SnoreMedic up close before the fitting process. The mouthpiece is made of a soft material which can bend, as illustrated here. Before fitting the SnoreMedic, you should look closely at it to see the word top printed on the top side of the mouthpiece. You will need to place the top of the mouthpiece on your upper teeth quickly once the mouthpiece is heated. To fit SnoreMedic, first boil water. Then, let the water sit for 20 seconds. After 20 seconds, submerge SnoreMedic into the boiled water for 17 seconds. After 17 seconds, remove the mouthpiece with a spatula and let it cool for 5 seconds before putting it in your mouth. Place the mouthpiece in your mouth and on your teeth, with the top side up. Hold your lower jaw forward and bite down for 1 minute. When you are done, you should notice deep impressions of your teeth. Remove the mouthpiece from your mouth and place in cool water for 1 minute to set the impression. You can refit the mouthpiece if you did not get a good impression or advance your lower jaw far enough to reduce snoring. These are results from a patient after wearing SnoreMedic for 3 nights. Before wearing SnoreMedic, the patient recorded snoring while they slept. For each of the 3 nights that the patient wore SnoreMedic, they recorded less snoring. These results indicate that the patient had reduced snoring while wearing SnoreMedic. These are oxygen saturation reports from the patient while wearing SnoreMedic. The results indicate that the patient was able to get enough oxygen while they slept. SnoreMedic has an airway opening of 3 mm. The airway may collapse during fitting, so it is critical to keep the airway plug fully inserted into the mouthpiece during fitting. You can clean SnoreMedic by using a toothbrush and toothpaste, or by soaking it in water with effervescent oral device cleaning tablets. Avoid using abrasive solutions such as household cleaners like ammonia or bleach. Overall, SnoreMedic can reduce snoring. It is important to maintain the opening of the airway while fitting, especially if you need to breathe through your mouth, instead of your nose, while you sleep. Thank you for watching this Snoring Mouthpiece review. For more reviews on mouthpieces to reduce snoring, visit SnoringMouthpieceReview.com.